These are the 10 most common penis problems with their treatments and solutions. Hi guys, Yaya here. Sometimes men are too embarrassed to talk about their intimate issues, especially if you're talking about our penises. Here we will discuss the 10 most common penis problems with their respective treatments and solutions. So you can have, an idea in how to solve them, or if you need to really, do something about it. Number 1, Pearly penile papules. Also called pink pearly papules. They are very small white or pink lumps usually found on the head of the penis. Most experts say that there is nothing to be concerned about. They're harmless, and they also advise to pop them, and never use an over the counter wire remover or something like that. So providers may suggest to use at least laser therapy. Number 2, jug rash. It is a ringworm infection, of the skin that causes an itchy red spot, often found, in the inner thighs and adjacent skin, including scrotum in males, and sometimes extend to the anal area. Treatment with an antifungal cream often helps. Number 3, Peroneus Disease. We have discussed this one before, and it's a curvature in the penis caused by scar tissue called plaque that forms inside the penis. It can make the penis bend upward or to the side. Many researchers believe that the plaque can start, after a trauma by hitting or bending the penis that causes bleeding inside of it. Most men adapt to it, but you can correct it with a penis extender. Number 4, penile cancer. While relatively uncommon, cancer of the penis can be serious. It's associated with ulcers or nodules on the penis, typically in the head, and don't always heal quickly. If you have any ulcer that doesn't heal, you need to check it out, of course. Almost all penile cancers, start in skin cells of the penis. Number 5, scrotal lumps. It is not caused by cancer; they are benign. The lump can be felt separately from the testicle. Men are most likely to develop this cyst around the age of 40 years. You always need to check them, with a doctor, to discard any cancer possibility or relation. Number 6, penile discharge. When the discharge is not normal, and comes along with pain or burning during urination, it could be a sign of an STD. It needs checking by a doctor. It could be gonorrhea. So this can be treated with 2 types of antibiotics. Number 7, blisters. Could be a sign of herpes, especially if painful. Get it checked. Unfortunately, herpes is for life and can reactivate at any time. But there are antiviral medications that can stop it if you start early enough. So see a doctor. Number 8, warts. A small bump on the genitals caused by a common sexually transmitted infection, the human papilloma virus. Treatment can help, but this condition can be cured. Number 9, erection problems. We have discussed erectile dysfunction before. Unfortunately, more and more complaints, are rising in men under the age of 40. This can be caused by anxiety, porn addiction, to blood flow problems, which can be, a warning sign of diabetes, or heart disease. Massagers, as the Penilizer, and pumps like Size Doctor Penis Pump, can help with a better, blood flow. If it keeps, happening, see a doctor. Number 10, phimosis, a condition in which the foreskin, is too tight to be retracted over the head of the penis, making urinating, washing, masturbating, and sex, especially complicated. The definitive treatment, is circumcision, to expose the head. Well, I hope you have found this information very useful. Always consult with your doctor or specialist, if you're experimenting any of these issues. In most of the cases, they are treatable in early stages. Any comments? Please leave them here, on the comment section down below. Don't forget to subscribe, guys. Don't forget to subscribe, and see you guys tomorrow.